Evening, everyone. Myself, Dr. Jyoti Banglawala, Committee Chairperson of Ethics and Medical Legal Committee of Fogsi. Today, presenting you 128th episode of Gyan Pravah podcast series, which is the brainchild of our respected, beloved Dr. Sunita Tandulwadkar, Madam, President Fogsi. This Gyan Pravah is giving us all a platform to explore our dimension, and side by side, we are actually coming with all the guests who are stalwart in their own fields with different topics. These topics may be from the yoga to infertility to endoscopy to health, any type of topic, any type of, even we are having so many politicians with us, so many lawyers with us, so many activists, NGO, so many people with us with different ideas which can actually help us to achieve the goal for achieving good health for the women. Madam is always believing in giving platform to all the committee chairperson, all the subordinates, all the people who are working with her. And this is the actually one thing in the era of social media, webinars, which is going on the YouTube for the general public also. This podcast will be available in the YouTube also. And later on also, we can see this podcast and actually benefited by this. Today, Madam is for an important meeting in the Frankfurt, and on her behalf, Dr. Ashwini Kale has been joined. Dr. Ashwini Kale is Joint Secretary for Foxy in 2025. She is the Chief Embryologist in Asha Kiran Hospital and a very, very hard-working, bubbly, bold, and beautiful doctor from our fraternity. I welcome you, Dr. Ashwini Kale, for your welcome speech. Our today's guest is Dr. Anubha Rastogi.
Thank you so much, madam. A warm welcome to Anubha, madam. So good to know that she's from Maharashtra. So we both from Maharashtra should welcome Jyoti, madam, from Indore. And it is such a nice topic that you have chosen, which is so close to our heart. Being a woman, all these sexual reproductive rights are so important. And today, on the occasion of World Environment Day, we were also speaking about sustainable menstruation. I mean, the right to actually have a period leave or the right to have a good and a safe place to change sanitary pads. I went through Anubha ma'am's CV. It is such an illustrative CV and so good to know, madam, that you have worked for the underprivileged in far northeast. I know it is such a far-fetched remote area and your passion for the work is definitely evident from all the work that you are doing. We at Foxy are a member society of 46,000 gynecologists who are spread across India. And we have also been working for women's healthcare 360 degrees, right from preconception care to our project, which is Know Your Numbers, where we are targeting four important figures for all the women who are above 12 years of age, like their hemoglobin, blood pressure, sugars, and weight. So that we know that if our woman is healthy today, she will become a healthy mother tomorrow. And when her aging comes, I mean, because longevity has increased now, she would also be healthy at that point of time, which is around, say, 60 years or 70 plus today. So, from all aspects, we are trying to target women's health. Our another project is also towards cancer, cervical cancer prevention and awareness against the cervical cancer. We are also targeting free vaccination across India against the HPV vaccine, as you must be knowing, wherever, whenever possible, either in the subsidized rates or even free. And another project is PEHEL, which is educating the boys against sexual health and menstruation. So this is for the first time that Foxy has even targeted boys for sexual education. And I feel this is becoming very important because once you make them aware of all this, probably their outlook towards the women and the girls may also change. And the way women are being harassed or treated in the society would change somewhere probably. So I'm very excited to listen to this. I will join in from the viewers link. And once again, welcome Anubha madam. And all the best wishes for you, Jyoti madam, for your podcast.
Thank you. Thank you, Dr. Ashwini. You rightly said today is the Environmental Day for the World Vishwa Paryavaran Divas. So, as you all know, the UNFPA data is saying there is the 4.5 billion people who are actually of the reproductive age who are in the any time of their life are looking for the reproductive services or sexual health services. And sexual health services and reproductive health rights, these are not only for the after marriage, just like you said, sustainable menstrual health. These are for boys, sexual health for boys. Everything is related to the SRHR rights. And today, as being a proud Foxian, we are so happy to see this Know Your Number, because this Know Your Number is just not for the pregnant patient. It is for adults and to menopause, and this is the actually right age group for all the women for avail all the rights available in their vicinity. Thank you, Dr. Ashwini, for joining us. Thank you very much. So, welcome, Dr. Anuma. This is a time for giving the formal introduction for you.
Dr. Banglowala, may I just say that I'm not a doctor, I'm an
Yes, sir.
advocate. I'm not a
Yes.
doctor.
Sorry.
No, please.
So,
Being
yes.
a doctor is a privilege, and I unfortunately
Yes,
don't have
yes.
that at this point.
Yes. So, Miss Madam Anubha Rastogi is a litigating lawyer for the past 20 years, and she is originally from Mumbai. She studied law from Law Center 1, Faculty of Law, DU, and started her practice with the Chambers of Law under Advocate Anupam Srivastavji. She then worked with the Women's Justice Initiative of the HRLN. She has also worked closely with a global software company to ensure that the workplace was free from the sexual harassment and discrimination further. Further, Ms. Rastogi has worked with the Center for Equity Studies and was part of a legal audit done on the state response in 7 specific post-partition communal massacre in India. She has also led the team representing the Dalit community in the Mirchpur. She is actively involved in issues of sexual and reproductive health and rights, and has authored Assessing the Judiciary's Role in Assess the Abortion in India Part 1, Part 2. She is currently based in Mumbai and also a special prosecutor for SEBI. Actually, Anubhaji, this just we are so used to say we did MBBS, we did MD. So these words are also so new to us. Uh, she has also actually she is currently based in Mumbai, and she is also a special prosecutor for SEBI and continues to work on issues of harassment, discrimination, and SRHR. I'm so happy to just tell you that we are 30 committee chairperson, and there is one committee which is known as Say No to Violence Against Women. This year, in the leadership of Dr. Sunita Tandulwadkar, madam, we are coming with another committee, Say No to Violence Against Doctors. So these two committees are actually working with all the people, even the, because it is not only for the doctors saying for the doctor or doctor doing for the doctor. We have to involve the community, we have to involve the society also. So many times you are actually coming across the issues of harassment, discrimination, and SRHR, and you are the best one to talk about all the things about this topic, because sometimes we are knowing what we want to do, but the path, how to lead this path, we actually need some learned person who know the law, who know how to make possible this law to be implemented. So welcome you, Anubhaji, for this podcast series 128. Today's our
Thank you.
topic is equity for all through the lens of SRHR. So first, just in the beginning, just as said you, this SRHR is not the means this is actually upcoming issue. Last 20 years only we are just reading about the SRHR. This is so hyped. But actually all the 4 fields like sexual rights and reproductive rights, sexual health and reproductive health, yeah, all 4 pillars are intermingled. And sometimes when we are saying sexual rights, it means automatically it means the reproductive rights. When we are saying reproductive health, it means the sexual health. Sometimes we are just using the whole terms SRHR. Still, I want to know from your mouth, what is basically this SRHR?
Okay. And you're right that this terminology has come quite recently, maybe about 20-25 years ago. But whatever is covered in SRHR are things that we have been talking about right from the Universal Declaration of Human Rights. If we look at the development of human rights law internationally, and then even within our constitution, we have the chapter on fundamental rights. It includes the specific right to life, right to personal liberty. So you're absolutely right that the terminology has come recently. It's only because we have understood how to articulate specific rights, specific aspects of rights, but access and entitlement was always there. It was always guaranteed by the constitution in the country, and was always articulated and guaranteed by international norms like the UDHR, that's the Universal Declaration of Human Rights, the ICCPR, the ICESCR, all of that. I think it's just so that there is specific work and specific emphasis, and that nothing gets missed out. That specifically we have now identified SRHR, which is Sexual Reproductive Health and Rights. SRHR stands for that. And it is an all-encompassing aspect. I've done a lot of work on women's rights, on women who face violence. And when I look at it from that point of view, I've always been of the opinion that if you are able to ensure that a person has been guaranteed and is able to ensure and access all aspects of SRHR, I think you will be able to deal with a lot of, at least domestic violence, a lot of, घरेलू हिंसा हम जिसको कहते हैं, we will be able to deal with a lot of that. And why do I say that? I say that because something like SRHR, Sexual Reproductive Health and Rights, it includes your ability to make decisions, your ability to actually be able to decide for yourself what will happen with your body, what will happen with your sexuality, what will happen with your reproductive self. So which means that I, as an individual, I have all the information that is required. So if for example, if I want to get sexually active, I know, I have information about how one gets sexually active. I have information about contraception. I have information about emergency contraception. If I want to be able to do that in outside of a marriage relationship or a relationship, really, I have the right to do that. That there are no societal barriers which are stopping me. And if there is any barrier that is stopping me from the society, the law enforcement is ensuring that my rights are not curtailed. If my rights are curtailed, then I have a mechanism to seek redressal. So, when we're talking about only SRHR, I'm talking about so many things, because then I'm talking about an individual who is able to decide for itself who to marry, if to marry or not, when to get sexual, how to get sexual, who to get sexual with, whether to have, whether to get pregnant or not, whether to continue a pregnancy or not, what to do if you change your mind about the pregnancy, what to do after that, what is the information that I need, what is the infrastructure that I need, because if I have the right to decide all of this for myself, then obviously, apart from information, I also need a working public health system. I need access to a private health system, which is also affordable, which will ensure that my rights are always maintained, which is appropriate to my, to my understanding, to my cultural upbringing, and which is also acceptable to me. There is nothing forced. So when we talk about SRHR, I have always been of the opinion that you can actually deal with a lot of aspects of other rights, like, for example, women's rights, trans persons' rights, sexual minorities, even religious minorities, even caste-based atrocities. I think a lot of that can also be dealt with from the prism of when you're ensuring that SRHR is being accessible, is there, that entitlement is there, and that it is being preserved. Even when we look at, say, differently abled persons, even from that point of view, if we are focusing on SRHR, we will be able to deal with a lot of other issues that come up, which includes discrimination, which includes discrimination on the basis of caste, class, sex, religion, all of that.
Actually, we can just say that it is the person's right. It is the women, or means men, women, both, their right to make fully informed and actually determined decision about their body, their sexual preferences, the contraception uses, sexual partners, and even the access to sexual health information. Because when we are reading about this, and this topic we have just, I'm the member of South Asian Gynec Federation, SRHR executive member, the committee member. When I was reading the right for adolescent girl, the sexual and reproductive right for adolescent girl, there actually the counseling part, the access to the services, because sometimes the adolescent girl, she is totally dependent on their parents. She is
Right.
dependent on their parents, and but she wants to know something. She wants to access the means even if the parents are saying to just not use the hygienic way, not advising her the hygienic way to routine the menstrual hygiene, the they want to go to doctors, they want to go to counselor, but there are no access to these services. So this is actually basically this is also one of the strongest pillar for this SRHR rights. The person should have access to the information, access to the counseling center, access to the health centers also, and there must not be any discrimination, there must not be any violence, there must not be any coercion also, because sometimes this girl, she's getting pregnant in the adolescent age group. She doesn't want to continue the pregnancy. But there are so many laws like POXO, there are so many laws, empty intermingling of the laws. There are so gray zone of the laws between the POXO and the MTP
MTP
law.
Act.
So we have to see in the whole for this girl's health, this girl's future, her mental or physical trauma she will be going through. So in near future, this must be taken care of. This topic must be taken care just for the health, because in our countries the girls are sexually active. We are seeing the girls are sexually active at the age of 12 years, 13 years, 14 years. Under the POXO Act, the doctors are not even going to say just use contraception. They are not going in the schools to just define the contraception, because it is also coming under the POXO. Because we
That's
are
right.
just pushing them to get sexually active. But when we are not telling about the contraception, when we are not telling her about the sexually transmitted disease, AIDS, HIV, so she is in the risk zone. So this is also a major
Absolutely.
part of SRHR,
Absolutely.
and we should start from the adolescent to menopause. Actually, everybody has a right about her body, but these adolescent girls, they are having very little knowledge, and actually the determined decision about their own body, their sexual preferences only can be possible when these girls are fully informed. Yes, I
In
just
fact, it's interesting because the government of India also had a very vibrant program on, on this RKSK for a really, really long time, where there was a lot of emphasis on information sharing with adolescents, not only girls but even boys or trans persons, or whatever you category you think you belong to have accessible information, to have information in the language that you understand, in the manner which is appropriate for you. But however, it's quite unfortunate that emphasis from that has now moved in RKSK only to menstruation, while otherwise when it initially had been launched and did exist for a really long time, it was an over encompassing and overall kind of program which really dealt with all of these aspects. And you're absolutely right, with POXO being in the picture, and I mean, of course, the intent of POXO, because obviously, you are doctors, you're gynecologists, so you would know this far better than I do, that instances of sexual violence with the minor persons have always been at a very, very high, and especially by a known person. And that results in sexually transmitted diseases, sexual issues, pregnancy even, maybe. And that has also there's always an intention to cover it up, because there is so much taboo involved with that. However, the intent of a legislation like POXO, the Protection of Children from Sexual Offences Act, was to ensure that people are not left scot-free when there is an offense. However, there are provisions which are concerning, like the mandatory reporting. I think there needs to be some kind of balance drawn, so that it's not at the cost of accessing services. And also, like you said, that even talking about contraception, talking about sexuality, giving sex education to persons below 18 then becomes a concern, because the apprehension that they might get sexually active is also an offense under is something that you have to mandatorily report. and any sexual activity under 18 is an offense. So in that sense, I completely agree with you that it has left young persons in sort of a lurch, because now they are dependent on the information that they can access on the internet, which could be just about anything. There is no way of ensuring that the information that they are accessing on their own is actually appropriate, is correct, is not misogynist, and is giving them the proper information, and they have the scope to also ask questions and really clarify their doubts. So that major gap is now in existence, which is, it's quite sad. Yeah.
Actually, in India, we are seeing this SRHRs. We are just having more than 29 years we are working, and we are seeing the different type of programs coming up with the government.
Right.
One of the country, Nepal. The Nepal has started this sexual SRHR services in 2018 only, and there every school is having one room where the adolescent age girl can go, and just there are not no doctors, and just like a Asha Karyakarta or just NM or just their teachers, they are just counseling them. So when we are seeing the very small countries like Nepal and Bhutan, they are doing so much work for SRHR, just seeing, because this foundation must be very strong. When the foundation is weak, this girl is not getting proper information about the contraception uses or sexually transmitted diseases. She cannot make the decisions. There, the internet is full of the wrong information, full of the things which can lead this girl to the wrong path. Though we cannot discriminate her by the age, if the girl is thinking that she is physically mature or she is mentally independent, like 16 or 17 years age group of girls, and they want to make the decision of their sexual partners about anything, we cannot stop them. But actually, we should give them the counseling. And just like I can just say, in just like in after MBBS, we are doing so many branches, like gynecologist to medicine to orthopedic, every type of branches. I think law is also having the same thing. So there must be something you just thought about to work for this SRHR. There must be some incidents why you just thought about to do so much work in this field. Because I just went through your CV. You have done so much thing for this Dalit. I read about this Mirchpur incidents also. I'm so impressed. What that particular incidents which make you to just work for this SRHR?
I think, I had not really specifically articulated it for myself when I started practice. But when I was working with the Women's Justice Initiative in the Human Rights Law Network in Delhi, there was a particular PIL that I had become part of. It was already ongoing before I had joined a Human Rights Law Network. It was on the aspect of unsafe sterilization and all, these sterilization camps that were being mandated by the government for women especially. And it's while I was part of that particular case, and there was a PIL going on in the Supreme Court, and the Supreme Court had issued guidelines, and all the states had to file their replies, their affidavits of compliance, and I was part of the team which was compiling all of that. It's then that I actually started reading about reproductive rights. I got introduced to the Center for Reproductive Rights, which is based in New York, and I was looking at the kind of work that they do, and that's when I started doing a correlation, because apart from PILs, etc., since I was part of the Women's Justice Initiative, I used to deal with women facing violence every single day. I was representing them in court, and it got me thinking that, like, what I explained earlier, it got me thinking that if one is able to really navigate SRHR, then issues of you being able to decide whether you want to marry or not, or who you want to marry, or when you want to marry, what do you want to do with your life, you want to study, you want to have a child, you don't want to have a child, you want to get pregnant, you want to get sexually active, you don't want to get sexually active, you want information about contraception, all of those aspects, there are so many issues which can actually get dealt with. Because if I'm talking about a person having the decision making power to decide when and how to get sexually active, what to do with its own body, then automatically forced marriages are out of the picture, early marriages are out of the picture. Automatically domestic violence to some extent will be out of the picture. Sexual assault to some extent would be out of the picture. And also just empowering people to be able to really talk about and think and decide and seek information without really being without considering it a taboo. Like you were talking about how it's important that adolescent girls are able to go to a gynecologist and ask for information. But I was just thinking at that time that there's also so much taboo involved. Like even when a minor or even a major girl, when she wants to access gynecological services, and this is outside of, if she's not in a married situation, mostly she will never go to the local gynecologist. She will always travel somewhere and go to a place where she will not be known, and it's very unlikely that the gynecologist will know the family or know her neighborhood or anything like that. Why is that? Because there is so much shame and taboo involved. That what if people come to know, what if my neighbor sees me in the waiting room of this gynecologist and then goes and tells home. There is so many layers of issues. When we start unpacking the issue of SRHR, we actually come across so many other layers. If we are talking about access, but if it is a communally sensitive area, then access will not be there for people who belong to religious minorities, or the access would not be enough. It would not be appropriate. So there are so many issues. If you look at it only from the SRHR point of view and really focus that, okay, we want to ensure that SRHR services and rights are there for everyone, you actually end up touching so many other issues and end up trying to at least start dealing with them. I'm not saying that this is the solution to all problems. No, but it does bring to its core a number of issues.
Actually, it is considered as the most controversial and most sensitive issue in our country, in all over world. It is a very controversial subject, and it is actually sensitive subject. And when you are saying this is the religious minority or some communities or some even not religious minority, if there is some low socioeconomic group or even I have just seen so many persons who are actually belong to the highly affluent groups, highly educated group, but still there is a taboo. And this
Right.
and when this girl, most of the time you rightly said, the girl is ending up going to the another gynecologist from the another town. Sometimes the girls are coming to the gynecologist. Sometimes the gynecologist herself is so much non-convinced to say something to the girl. This is the layers. It is not
Correct. There's so
universal.
much judgment also.
Yes,
That's
it is a
right.
judgmental behavior of the society for the caretakers and caregivers. The both sides are affected by this controversial subject, and there are so many subjects related to this SRHR. But few, I just request you to just tell about few most pressing subjects of the SRHR. Like first, we are talking about the adolescent. I sometimes think about the abortion care services also are so much pressing subject in SRHR. No girl or no woman is a solely means is able to take the sole responsibility for the termination. She has to just see for her husband's consent, her in-laws' consent. And sometimes so we are seeing parents also coming, means husband and in-laws are saying इसके मायके वाले से भी पूछ लो वरना बाद में मना करेंगे. So one girl who is pregnant only 9 to 10 or 13 weeks, she is coming with in-laws, with parents, with husband, sometimes friends also. So what are the some most pressing SRHR issue our society is facing, and if you are tackling all the cases you are seeing?
No, absolutely. I agree with you. And I mean, we've talked quite a bit about adolescent persons, and even in abortion, the example that you have given, but the law otherwise is very clear. It's only the consent of the pregnant person that is required. And a medical termination of pregnancy cannot be forced on someone. So even if this person is a minor, the pregnant person is a minor, even then, if the consent of the minor is not there, and there are so many judgments of various high courts, including the Bombay High Court, on this, that you cannot force an abortion. However, the consent to not continue the pregnancy, or to continue the pregnancy, is not, she's not never really asked whether you want to continue the pregnancy. You can, I mean, it's unfortunate that the law is in a manner where without your consent a pregnancy cannot be terminated, but without your consent you can be forced to continue a pregnancy. Because the MPP Act is currently, even now, in the way it's worded, it's not a rights based. It's not really giving me a right. Although there are judgments of the Supreme Court and again various high courts, including the Bombay High Court, where it has been articulated in a manner, jurisprudence has been created, which is indicating that access to access to abortion is a fundamental right. It's part of the pregnant person's right to life and personal liberty and privacy. But the law, even after amendment, has not reflected that. So apart from adolescents, apart from abortion, I would think the other pressing issue definitely is contraception. And contraception and access to information. So there is, we keep saying that there is this basket of choice, which has, I think, now become a room full of choices, because there are so many choices. But where is the information? Who is going to tell me what happens to my body if I use X, or if I use Y, or if I use Z? That kind of accessible information is not there. And sometimes, and in that, and which we have seen in previously also, that sometimes some contraceptive methods are also forced on you, because either there's a mandate or whatever it is. I mean, I don't want to get into all of that, but where is the choice really? The choice is when I have access to all possible options, and I have information about all possible options. And information doesn't only include how to use it, but information also includes what is the side effect, if any. How do I stop using it? How can I start using it? All of that. And whether it is acceptable to me, or whether it is something that aligns with who I am, with my physical self. Like I remember that there was an example a long time ago. We were I was taking some session in UP, and we were informed, some of the participants were sharing that this copper tea was being used in government hospitals. However, those copper tea, the instrument was something that had actually been designed for African women. But it was being used because I think it had been manufactured a lot, or I don't really recall the exact concern. But it was, it had been sent to the government hospitals in India, in UP as well. And so it turned out that they were too big for Indian women, for Asian women, but they were still being used. So while you are asking me for, whether I want to use a contraceptive, you're explaining to me what it means. I'm saying yes. So all of those, there is a tick in the box for all of that. But what you have given to me is not even appropriate for me, is in fact causing me more harm, and is probably putting me off any contraception. Because then my mindset is कि इससे तो problem होगी, तो मुझे नहीं चाहिए. So there is so much more that needs to be done, apart from just letting us know कि okay, ये भी option है, आप patch लगा लो, आप injection ले लो, दवाई खा लो, and all of that. But what does all of that mean? And I think the other aspect that I would definitely want to talk about when I'm talking about SRHR is really really looking at, and like the program that you are doing, from adolescence to menopause and beyond. I really looking at SRHR not just limited to the reproductive self. Because when we talk about SRHR, somehow it gets distilled only to pregnancy, childbirth, contraception, abortion. But there is so much more in SRHR when we talk about, when we talk about the overall health.
Actually, the education, the main crux is the education.
Information. That's what I was
Information
just.
and education. There should be an information kiosk for everyone. There should be the booklet, even the small booklet should be circulated. We are saying so many things. But when we were student, just you are just saying about this contraception IUCD devices, uh, the level of the education in our rural women is so low that time. When I was the registrar in my hospital, when I was doing PG, that time when we do hysterectomy, you understand hysterectomy, uterus, when we are removing the uterus and then we are
Right.
sending, when we are doing, after removing, we are just cutting the uterus for sending to the pathology lab. That time, so many, I'm just telling about 35, 40 years back, the basic sonography was going to happen. Most of the time, IUCD lying inside the uterus in the sonography report. Most of the time,
Hmm.
we are just removing the IUCD, but it was impacted with so many years, 15 years, 16 years, 18
My
years.
God.
And the woman was actually undergoing for the uterus removal operation. We are just removing the uterus and we are removing the copper also. एक बार उनको जो लगा दिया सेकेंड या थर्ड या फोर्थ बच्चे के टाइम पे, आप इसको जबरदस्ती बोल सकते हैं, but there is no other choice because they are not having any choice. They are not having any access to the contraceptive tablets. Their husbands are not using the barrier methods. So this was the best thing the government doctor can do that time. अब भाई आपको एक कॉन्ट्रासेप्टिव एक कॉपर्टी डाल रहे हैं, सो आपको कॉपर्टी डाल दिया है, कॉपर्टी डालने के बाद वो लेडी कभी आपके पास वापस नहीं आई, बिकॉज द लास्ट चाइल्ड बर्थ, उसके बाद इफ शी इज नॉट कंसीविंग शी इज नॉट गोइंग टू द गायनेकोलॉजिस्ट. Then after 20 years, 15 years, when she is facing the menopausal problem or some other problem, she is coming to the doctor and the IUCD is impacted in the uterus. So we have seen those era also. We are seeing the same. This is a very modern era. Women are literally coming with so much information. Most of the time, these are the wrong information also.
Yeah.
But the easily accessible information from the government sides, from the private doctor side, there is must. When we are just typing, I have just seen when we are typing contraceptive choices, so many wrong information is coming from the Google. So there is no monitoring system on the social media also. So there should be this choice basket of choice. The information of basket of choice should be given by the government or the private sector also. We in the Foxy, we are actually having so many publications about the abortion care, the MTP service, every topic. We are just giving the choices to our doctors also how to proceed with particular this case, or is continuous online education programs are going on, or educational CME or virtual or physical going on. But from the part of the society, from the part of the government, this taboo you are saying, we are actually ready to give the information. Sometimes when we were going to the schools, previously there are so many school education program. Once in a month, the gynecologist used to visit the schools. Previously, it is happening. Just when the POXO is given so much importance, the gynecologist actually very fearful to giving the information about the contraceptive practices to the age group of 10th to 12th standard girls. Sometimes parents are coming to the school. वो आपकी फलाना गायनेकोलॉजिस्ट आ रही थी, हमारी लड़कियों को तो बिगाड़ कर चली गई, जो इन्फॉर्मेशन की जरूरत नहीं थी वो दे के चली गई. But still, as a gynecologist, it is my actually thinking that from the adolescent only, from the right age only, when we are providing the right information, that girl may choose wisely in later life. If you are not giving information at the right age, she is not even knowing about the right practices also. What means,
That's right. That's
but
absolutely
we
right. And the information, is not, it should not be restricted only to the girls.
yes, the
You know,
boys
it,
also,
you
when
know,
we are doing no to violence against women program, and we are just choosing the sixth to 12th standard boys and girls. Sometimes we are giving information to boys also. This whenever we just talk to the boys, they are telling about so many things about the domestic violence which is happening to their mothers, their
right.
sisters. And the boy is growing up seeing the mother is suffering from the violence, bhabhi is suffering from the violence, sister is suffering from the violence, indirectly they are thinking it is good to do violence with the women.
It's okay to do. Yeah, it's
It's
okay to
okay to do.
behave like
Nobody
this.
is saying no. उनकी मदर को मार पड़ रही है, सारे बच्चे देख रहे हैं, तो it is indirectly infiltrating in the mind कि it is okay to do such things. हाँ, ये ऐसा चल सकता है. So when we are telling them it is not right, so they are saying अरे ऐसा तो चलता है मैडम, थोड़ा सा मार दिया तो क्या हुआ. So this is actually, this starts with the both gender, and sometimes this SRHR services, I just want to know from you, how do you face some problem of the caste or creed or class, gender, even the gender identity? There are so many identity about the genders and disability. How this all this problem intersect with the SRHR activities or SRHR when we want to do something? How these issues of everything intersect with the SRHR?
I think it's not, I mean, these issues are not really only limited to SRHR, because it also is reflective of your own perceptions and your own biases. I mean, why would there be discrimination for a particular or against a particular caste or class or religion for any medical services? It will be there only when there is bias in the system, or there is bias in the service provider, and like I said, I mean, sometimes it happens that where there are ghettos, if it belongs to a particular minority religion, or if it belongs to a particular caste, then access to health services is not really prioritized there. So then that's the system being discriminatory there, where it's not important that there are functional hospitals, public, private, whatever, or if the private ones are there, they're not being monitored properly or monitored enough. So it's not just limited to SRHR, but when we come to gender identities, then something like an SRHR service plays a major role, because there is the law is still catching up. While medical and scientific advancement has happened, and so many more things are possible now, and there is information, there is awareness about the self. So there is so much about yourself now, which may not have been possible, or it was possible, but you didn't have the words, say, some 30-40 years ago. But today it's possible. You also have the language, you have the vocabulary to actually articulate ki, what am I feeling, who do I think I am, and of course, like I said, that there is also scientific development that has happened. So I can actually change, I can have a sex reassignment surgery, and I can actually become the person who I think I am. But
Yes.
in all of that, is the system ready? So what if I need contraception? What if I need access to abortion? What if I need information? What if I need counseling? Is the system ready to deal with me? And that's where I say that the system is still catching up. There is a lot that is still required to be done. And while the system is catching up, I think even private practitioners are still, sort of unclear about what is to be done. And I mean, I keep saying this, and I don't say this only to doctors, I say this to all kinds of service providers, whether you're whether you're from the law enforcement agency, whether you're from the judiciary, whether you're from anywhere, as long as you're at least doing what you're expected to do, I think we will solve half the problem.
So do you
Irrespective of what you think.
okay.
So you may think कि ये क्या है और ऐसे क्यों है, पर अगर मेरा काम है कि मुझे सर्विस देनी है, तो मैं अपना काम करूंगी.
So just you think about this, our current law system or our policies are so inclusive or protective about the SRHR services?
See, it's in bits and pieces. I mean, we have laws, like actual laws like the MTP Act on specific things. It's not like we have an overarching or a law which covers all aspects. Like, we have the MTP Act, we have the Prohibition of Child Marriage Act. So in a sense, they are touching on SRHR. We have POXO, we have the trans persons law.
We have POSH Act. We are having POSH Act everywhere. We are just after Nirbhaya. Every working place is so means they are making committees and they are actually
Correct. So, and we have the, the sexual harassment at workplace
yes,
law,
yes,
again, it touches on aspects. We have rape laws, we have specific laws on various aspects of rape, in our criminal law. So in a sense, there are various laws which are touching on different aspects. And we have our constitution of the country, which is recognizing aspects of these as fundamental rights. But where the gap really lies, and I'm really talking as a legal practitioner here, maybe not so much, not so much at the ground level, because you would know this better. But where the gap really lies from my point of view is that what the constitution and what the constitutional courts are saying, what the law is saying, and what is happening in reality, there's a major mismatch. They are not informing each other. So for example, the right to privacy judgment had touched upon access to abortion and had actually very clearly stated that access to abortion and the decision making autonomy is with the pregnant person, and it's within your right. But do you think I can take that 600-page judgment to my gynecologist and say,
no.
he's saying it's my right, तो forget the MTP Act, मेरा हक है, मुझे नहीं करनी है pregnancy continue, please give me an abortion? No, I cannot. Or for example, in September 22, I think, the Supreme Court had come out with a very, very good judgment on POXO. Where while it was talking about other things, it was also talking about being able to really harmoniously, interpret POXO and the mandatory reporting in POXO and the necessity to provide service under the MTP Act. So where the pregnant person is a minor, and the pregnant person, what the judgment said was where the pregnant person is saying that I don't want to continue this pregnancy, but please don't reveal my identity to the police. So then the Supreme Court in that judgment had said that the doctor should still mandatorily report, but not reveal the identity. But my problem is that local police person going to understand this? If you as a gynecologist have that X versus state ka judgment and you show it to the police wala, he or she is going to say, boss, this is not, what am I supposed to do? POXO is saying you have to mandatorily report, tell me kaun hai ye ladki. So the gap, we have some very, very good laws. We have some fantastic judgments. But this gap is where everything falls. It's not even a crack. Everything just falls. It doesn't reach the grassroots, which is the biggest concern. And really, because the audience here primarily is gynecologists, I really appeal, and I do feel bad for especially for gynecologists, because you've dealt with PCP and DT and now you're dealing with POXO. There is so much more. Suddenly you think that it's, let me just not deal with this issue. But the fact remains that if you will not provide this service, who else will? The law has mandated that you will provide these services. There is nobody else who can provide these services. So if you start closing your doors, where are these pregnant persons going to go? The ones who have some resource, the ones who have some money will go and do something somewhere else. But a lot of them would be the ones who are vulnerable in all senses of the term.
Actually, this MTP law, when it is amended, and previously twice it is amended, and Fogsi was having a big role in the amendment.
Right. I'm aware of it.
There are these two words which are replaced. Previously, it was the married woman, married lady. It was replaced by any lady. Another word was the husband. It is replaced by the partner. Fogsi was our past president, Dr. Jaideep Nag, and
Yes.
he was the Secretary General that time when this
Yes.
law amendment was going on.
Right.
Actually, we are also facing so much problem. Most of our doctors are they are just stopping practicing the general obstetrics. They are saying this is a very minor procedure. For very minor procedure, we have to fill lot many forms. We have to just all the time check the Aadhaar card. If the girl is on the gray area, she is actually just completing 18 years, and we are seeing she is 14 or 15 years aged, weeks pregnant. We have to just think when she became pregnant, that time she was 17 and half, or she was not completed the 18 years. So we have to go to the POXO Act. Just rightly you said, police person said, Madam, आप निपटा लो आपके हिसाब से हमें नहीं मालूम है. Then sometimes out of concern we are doing something for girls' health, and the girl with the parents coming to the clinic after 2 or 3 months with some court case or some police complaint about the boyfriend or the sexual partner about the rape, and someone is asking where is the abortus, have you stored or not. There's so many problems going on with the doctors. So I just hope someday, just by counseling or with the association of our lawyer friends, our NGOs, our gynecologists, we can come up with a good solution. And the methods are easy, but the hassles and the harassment at the writing level, at the government level, is so much. Gynecologists are actually denying for the abortion care services. They are just denying. You also
Absolutely.
know.
And and may I also say this? And of course, I'm very well aware of Dr. Tank's work. In fact, he's also part of the campaign advisory group at the Pratikya campaign that I'm also part of. And we worked closely on some issues. But the point that I want to make is, if you're looking at POXO, while mandatory reporting and not reporting mandatorily is an offense, not providing a service that a survivor of violence, a minor survivor of violence requires, which includes an abortion, is also an offense.
Hmm.
So my point is, please provide the service.
Yes.
And
Correct.
Dr. Banglowala, I will say this, and I mean, I do understand the kind of concerns that gynecologists have to deal with, shutting down of clinic, and the kind of violence that has suddenly erupted against doctors. I mean, there is a lot that is required to be done. But I will, at the cost of reputation, I will say this, that if all gynecologists stop practicing this particular minor procedure because it's so inconvenient, what is going to happen? Oh, and it is inconvenient. I completely agree. There are 20 forms that you have to fill. You have to consider the PCP and ET Act. You have to consider POXO. You have to consider so many things. But then, if it's becoming a concern, maybe Foxy has always been such a strong body, has brought in so many changes. Maybe these are also things that I mean, of course, you have been working.
Actually, we are doing. We are timely. We are just informing our gynecologist about how to make easier this process, how to fill the forms, how we should not trap in any litigation, because we are basically the service providers. We just want women to achieve good health. We just want to provide services. If our gynecologist friends, our colleagues are facing problem, timely we are just doing the CMEs, timely we are providing the information, and even our website, they are just having all the things to access for the gynecologist. And there are actually just like you and just like me, there are so many things, there are so many things which are giving hope that we can fight for SRHR activity. Which particular one thing you are just want to fight always for this SRHR activity?
The ideal situation, which is what I'm really hoping, I don't think I'll see it in my lifetime, is that all persons have the capacity to decide for themselves, and for them to reach that decision, everything that is required for them to be reached, for them to come to that decision, is available, is accessible, is affordable, all of that. That is, I think, that is the one thing that I'm really looking forward to. But I'm quite
Optimistic
maybe
about
you
it.
call me a
I'm
pessimist
tall.
on that, but I'm quite clear that it's not something I will see. But I'm hoping that my work will be a drop in that ocean and will take that at least to some extent ahead. And I also just wanted to say, because that stayed with me, where you said about the Aadhaar card. See, the MTP Act does not talk about any identity documents, and I understand that doctors, to safeguard themselves, and rightly so, will ask for identity documents. My only plea will always be that yes, you must do things to safeguard yourself, but you must also ensure that in the process you don't end up not providing the service that you were expected to, especially considering the fact that you are the only ones who can provide this service.
Now, service, we are the service provider. We actually took oath to give services to women's health of the India and the world. So it is our primarily duty. And as you rightly said, today's listener are mostly are the gynecologist. When this episode will be uploaded in YouTube, the listener maybe so many listeners would be the non-gynecologist friends also. Viewers are the mixed group of viewers. So I just want you to just give one message to all the listener how they can support the SRHR activity and how they can support to the equality of the both the genders, both the classes, both the means no discrimination about the class, creed, caste, community or gender. How we can just support this SRHR as a person who is working so much for SRHR activity, just for all the viewers, for gynecologists, for the non-gynecologists, for the means doctor community, what we can do for support this SRHR from
I think
our
the
level, private level, in the public level, at the personal level, in the social level also.
I think the biggest support to any rights-based cause, whether that is SRHR or anything else, would be to really question your own prejudices and to also really be aware of what you are thinking as being the truth or being the reality. Is it actually that? Because it's from there, once we start questioning ourselves, is when we will start seeking the truth. Till we don't question ourselves, till we believe that what we know is right, yeah, aisa hi hota hai, if that's our belief, we will never question anything, and then we will not be able to change anything. If we keep believing that this is what women are supposed to do, this is what men are supposed to do, this is how, this is what a family should look like, if we keep believing in these things, if we don't question these norms, which keep changing with changes in society, if we don't question all of this, then we will remain stuck in the rut that we are, even for the next 50 years, 60 years, 80 years. I think what is important, whether it's SRHR, whether it's anything, is to start questioning कि क्या यही सही है, क्या ऐसे ही होता है, क्या ये सच है, और क्या कुछ और मुमकिन है.
कोई
I
एक
think
कोई एक लाइन आपको बोलने के लिए बोली जाए, जो आप पॉलिसी मेकर्स को कुछ एक चीज बोलना सजेस्ट करना चाहेंगी टू जस्ट मेक द SRHR फॉर द सस्टेनेबल इंडिया, फॉर व्हाट टू
I
इट
think
डू?
in the Indian context, if I'm addressing policymakers, I would definitely say that there is a lot of knowledge and a lot of information, lot of tools that are available in the form of judgments, in the form of our laws, in the form of constitutional interpretations. I think if we are able to, as policymakers, put all of them together and then devise our policies, we will have far more inclusive and far more rights based approaches when we are looking at it from the government, from the policy point of view. That is what I would.
Actually, what we think, just there are so many programs going on for the reducing the maternal mortality rate, reducing the maternal morbidity rate, neonatal mortality rate. We are just hoping, because this lack of access to SRHR services leads to so many things. So
Absolutely.
these are leading to the negative outcome from the men and women both. So if we are denying for the SRHR services to our doorsteps, then we are just increasing everything. The government programs, even the government is making program for the maternal mortality, they have to include the SRHR services program with them. So actually, this is the choice of basket. This just like the contraceptive. This is the choice of basket for SRHR services also. Everything is interconnected, intersected. So I hope आपके जैसे कुछ और लोग हो जो अपनी आवाज बहुत बुलंद तरीके से उठाएं, बिकॉज वेन एवर आई मेट यू आई जस्ट रियलाइज्ड कि हाँ, ऐसा मैंने जब when you asked me कि why you are denying for the abortion care services, yes, I just thought when I am denying one abortion, that girl may go to one quack, that girl may just she may be having some problem. वो मेरे पास आई है, मैं मना कर रही हूँ, क्वेक के पास गई है, और उसके बाद वो एक विशियस साइकिल शुरू हो जाएगी मॉर्बिडिटी
Absolutely.
की. I
Absolutely.
myself feel guilty कि no, we as a service provider we should not say no to our women, but we are just hoping to just cooperate with all our doctor fraternity, being a lawyer. And thank you very much for just addressing on this. Actually, this topic is so vast. All the four pillars, when we start talking, this will take 5 hours, 5 days, but still you touched all the area. Thank you very much, Anubaji. Thank you.
Thank you so much for having me. Thank you.
Thank you. Thank you and good night. Thank you.
Good night.